Erica, over the past year, doctors, parents, and young people have told us about the negative impacts of high THC marijuana. They say it's causing problems from cannabis-induced psychosis to other serious health symptoms. Cannabis Control Commission Chair Shannon O'Brien says she's concerned but not convinced that recreational marijuana is the problem, despite findings from a study in the American Journal of Preventive Medicine that we first told you about in November.
And what we found was really startling.
Dr. Cheryl Fu is one of the researchers who examined health records from more than 7,000 people treated by Mass General Psychiatric Emergency Service. They focused on those who tested positive for THC, comparing visits before recreational dispensaries opened to visits during the first year recreational marijuana was sold. The impact on young people was clear.
From 5% to nearly 20% of teenagers who had cannabis detected in their urine when they were coming in for a psychiatric emergency.
That's a 300% increase, an increase that was not present in other age groups.
The increasing availability of cannabis and high-potency cannabis is disproportionately affecting a vulnerable subgroup of teenagers, of youths.
Are you concerned about a correlation?
I'm concerned about a correlation.
But Cannabis Control Commission Chair Shannon O'Brien believes unregulated products could be the root of the problem.
There may be a timing correlation, but it sounds like the way that these kids are getting at these products, it's the unregulated market, it's the illegal market, it's the hemp-based gas station weed.
But top doctors, Mass General, Children's Hospital, they're telling us their patients are getting legalized weed, and that's what's causing the problem.
And that's why we need to do the public education program.
When we reported on this back in the fall, we asked the commission about it, and the commission was pretty dismissive, questioning the study altogether. Do you think this study is legitimate?
You can't get anything better than the gold standard in Massachusetts, but I can do, hopefully, additional work. How can we address these issues, including how do we, one, keep it away from kids, but two, how do we understand what the true sources of these problems really are?
Chair O'Brien points to other studies that she says show young people are mostly accessing unregulated hemp-based products, not regulated marijuana, which you have to be 21 to purchase. But the studies the commission sent us did not distinguish whether young people were more likely to be using unregulated or regulated cannabis. Mike Bodette, 5 Investigates.
Mike, thank you for that. And Shannon O'Brien is one of the guests this weekend on Cityline. The episode examines the state of cannabis in the Commonwealth. You can watch that interview and others Sunday at 11:30.